The COVID-19 vaccine clinic template package includes a practice level configuration template as well as an end user template. We'll start with a review of the configuration template. Once the latest download from NextGen has been applied to your database, click the vaccine manufacturer field to launch your vaccine inventory. Search for your manufacturer, CVX, and CPT that you wish to apply, and then click OK. You have options to add 2 different admin codes, and then also specify the interval days. Each manufacturer's second dose interval days is slightly different, and here's where you can indicate that information. Click Add to add it to the grid, and then this information will be used when documenting the immunization. The second panel is the future appointment configuration, where you can enable appointment scheduling from the end user template. Signify the location, the resource, as well as the event to be utilized. Input an appointment result limit if needed. Note whether it's a search default or an appointment default, and then click Add. Information will then display in this grid below, and then will be applied on the end user template. This last panel is the template default setup. Here's where you can set some settings that allow for quick efficiency on the end user template. This first setting is the patient search. You can set a default for users to search by patient name or by patients with appointments only. You can use a default for VFC, whether it's non-VFC or VFC. And the registry fields where you can default the appropriate registry that you're using. The encounter document is where you can default an encounter document to be generated on the patient's chart once the immunization has been documented. In the ordering provider section, you have an option to signify the ordering provider based off patient age. So for adults, you can choose one provider, and pediatric, you can choose a different. The update status allows you to input a default value, which will update your workflow status with the default value that you have in the field. If you enable the vaccine priority, that will display on the end user template, and then you can also make that a required field. Once your configuration is completed, you'll click Save and Close, and then we'll take a look at the end user template and how that applies. Now that we've reviewed and updated the configuration template, we'll review the end user side. This template has 2 panels for documentation, the vaccine administration and then the vaccine administration log. In the vaccine administration panel, based off the configuration, is where you could have defaulted how users search for patients, whether that was by demographic details like last name, first name, date of birth, or if you defaulted by appointments, they'll search by appointment date and appointment resource. Even though the default was set, users can still search for patient using either filter options. Depending on their filter, they'll click the search button and the appropriate list of names will display in the grid. If the patient is not found in the system, clicking this new patient button will allow them to enter the demographic details into the system so they can begin documenting the immunization. Highlighting the patient from the grid displays details below with a selected patient. If they had any allergies in their chart, that will list here in this grid. And then any previous COVID-19 vaccines that this patient has received would also display in the second grid. The Cdc Checklist button populates the Cdc COVID-19 pre-vaccination checklist, where users can select the appropriate radio buttons and document for their patient. Clicking this Open Chart button will launch the highlighted patient's chart. Since the patient that we have highlighted has not received a previous vaccine, our previous vaccine information is gridded and there's no alert. However, if a patient did receive previous vaccines, there would be alerts and the information would display in that grid. So for example, our patient above had received a previous vaccine and their dose is due in 17 days. Also, if a patient has received both vaccines, if they are selected from the grid, users will receive an alert that the patient has 2 documented COVID-19 vaccines. So going back to our patient who didn't have any vaccines, I'll highlight them from the grid again, and then we can begin documenting that immunization. So here in the Immunization Details section, if I click in the lot number field, this is where that vaccine inventory will launch, and I can select the appropriate vaccine that I'm giving my patient. When I click OK, the details display in the appropriate fields. My defaults that I set up are also selected, like the non-VFC, my registry, my vaccine priority. I can document the site with the immunization given, review all other details, and make any changes as needed for my patient. Now, since my patient hasn't received any previous COVID-19 vaccines, and we did set up future appointment scheduling in the configuration template, if I click our Save and Add New or the Save and Close on this patient, I'll get a list of appropriate future appointments to schedule for this patient. So the difference between the Save and Add New and the Save and Close, if I click Save and Add New, it will save the information for this patient, and then I can continue documenting on a new patient. If I save and close, it'll save all this information and then close the template. So I'm going to go ahead and click our Save and Add New. Then I'll get that next available appointments pop up based on the location, the resource, event, and then the specified appointment date for when the second dose is due. I can highlight the appropriate appointment that my patient wants to come in for that second dose, and then click OK. My template then stays on the screen, and I can search and begin documenting on a new patient. The bottom portion of this template is the vaccine administration log. And the log is where I can search and view previous vaccines that were documented. It'll default to the date. You can search by the specific location, and then the patient details will display in the grid. Highlighting a patient in the grid allows you to open the patient's chart. You can view the immunization record document. Clicking this open button allows you to view the details given for the vaccination. And then you can also remove the vaccine. Now, do keep in mind, to remove an immunization, you must also delete it from the procedure and immunizations module to fully remove it from the patient's chart. Once you've completed documentation on your immunizations for the day, clicking Save and Close will close the template. We'll now go into the patient that we documented the vaccine and see how this information displays in the chart. To save us some time, I've gone ahead and launched the patient's chart and also opened the Orders module. You'll notice that an encounter was created for today with our immunization with the appropriate resource and location. And then you can see our immunization document was generated. I also have a procedure and an order in the chart for that encounter. So in our Orders module, on the Orders summary, my patient now has a Pfizer COVID-19 vaccine that was administered with today's date. Also on the Immunizations tab, my immunization now lists COVID-19, the dose 1 date, and then when the patient comes back in for their second dose, we'll list the dose and the date appropriate. So that's all the information that's been documented for our patient using the COVID-19 vaccine clinic template.